Katie Lee is one of Australia's leading child and family consultants. Now, since COVID and the introduction of lockdowns and school closures, isolation and the sense of helplessness has had a dramatic impact on the mental health of many children. But Katie says it's in the strategies families and schools employ and their need to work together that is going to help children overcome and manage the challenges of the trauma that we've inflicted. Welcome, Katie.
Thank you. Welcome.
Now,
hi, how are you?
Good, thanks, Katie. Now, we've seen a lot of reports about kids struggling at school with regulation, not being able to play together, and a whole lot of other effects. What can we do as parents and as schools?
Okay, Michael, I'm glad you asked that. So what you really need to be looking at this moment in time is probably the 3 R's, which is reassurance, routine, and regulate. Children need to be reassured by adults that the world is a safe place. They need to reiterate time and again to children that they don't need to take care of that. They don't need to worry about their safety. Adults need to have that covered. They need to reassure them that that's our job as an adult to make sure that you are safe. They need to also have routine. Routine is very, very important, particularly when it comes to interacting again. We need the interpersonal and the intrapersonal. We need the children to be able to interpersonal react and move in circles with other children, work in team sports and things, as well as the intrapersonal, like, doing things for themselves, the individual. For example, like your daughter, she is part of a team of weightlifting, but she does her own thing and she is rewarded with her own goals and her own achievements. It's really important at this point in time to have a routine of some sort, particularly also at home. Sometimes it's difficult to have that meal on the table at a certain time, or to take that 5 minutes, particularly a routine of taking that 5 minutes to check in with each other. The adult checking in with the child checking in with the adult, and making sure that things are on task and everyone's traveling well. And whilst we can't react maybe at that point in time, make sure that they're heard. Also regulate and self-regulation, check in that they, how they're feeling and ask them how they're dealing with it. Let them have a sense of ownership. Self-efficacy is so important in a child. Separate their emotions from their identity and remind them that how they feel is not who they are. Quintessentially, they are, they have their opportunity, they have their own identity. And whilst, for example, I cry a lot, my emotions are high, but that's not my, that's not my identity as a person in my own right. And also be conscious of, vigilantly conscious at this point in time of being part of the environment, being outside of the walls, taking a walk on a beach, or just, sitting even in the backyard, with a tree, and be a part, if you can understand and react to what the child is needing at that point in time, you'll withdraw their traumas and their regression. I'm finding most children are not acting out. Prior to COVID, children that I was seeing used to act out a lot and, would have temper tantrums and things. Now I'm seeing parents saying children have regressed or withdrawn, and they're not really, they're doing the, are you okay? Yeah, I'm okay. They're not trusting. I think it comes back to that safety thing, reassuring that it's okay to be not okay.
Yep.
And yeah.
Yeah, we need to realise too that when we ask our child how they're feeling, a lot of them don't have the developmental cognitive
Correct.
skills to display it.
Correct.
If we look at their behaviour, we can
Correct.
tell what's driving their behaviour. We need to be detective
Correct.
and go beyond the
Correct.
superficial and go, oh, I know with Charlie, if I come home and she's distracting and hyper and, trying to get in the way of what needs to be done, I know if I give her 15 minutes of undivided attention, whether it's outside with a basketball, whether it's sitting down discussing a day, that need is met, and suddenly the behaviour changes and
Correct.
it becomes really simple. You
Correct.
mentioned routine. That's I imagine would be really important, because we know that authoritative parenting is really important for young kids, because it's very easy to become anxious and overwhelmed if they have unlimited choices and freedom to roam. It's like dropping a child in the middle of a field. No boundaries.
Absolutely. Absolutely. Look, we can't fix what we don't know is broken. And if a child doesn't know that something's broken, then they can't fix it. And then they do get apprehensive, So if they know their boundaries, and if there's a routine and there's a structure, not a vigilante one, but just, this is where I'm coming from. How do you feel about that? And they go, well, I'm not that impressed about it. And you say, okay, well, that's a movable object. We can probably work that around. How would you like to? Self-effacing, allow them to be part of the decision making. It is so important that children are given the responsibility of self-control and control of certain events. And then some things may not be movable objects. It is as it is.
Children,
for your safety.
Children don't learn to make good decisions by following orders.
Correct. They do not. They do not at all. No. And
now, is some of this, as you mentioned, children being withdrawn, and we're seeing a lot of reports about children's anxiety and that going up. Is that because they hadn't been exposed to being uncomfortable or awkward or unsure as they are when they go into new settings for a little while, so that those feelings are magnified now because they hadn't sort of become conditioned to them? Katie?
Well, it to a degree, but it also touches on your point that neurologically they're not developed enough. Children are structurally and functionally growing their brain. It's all, mental health is brain development and the ability to develop, unless, of course, you have a condition as such. That's a given. But generally, for the general public and the general children, their brain's undergoing the structural growth, and particularly between the ages of 2 and 7, and then again at adolescent. And they're where your wiring and your networking and your connections are done. Now, if you're not being exposed, e.g., COVID lockdown, to those neurological connections that you would normally have formed at that point in time, e.g., interacting with your own peers, structured learning, then those connections are not made. Yet now that COVID has passed and we're post-COVID, we've now gone, okay, go back to doing what you were doing. And they go, well, hang on, I've lost blocks of, my brain doesn't have that connection. And if it did have that connection in that, in all age groups, but particularly in the 2 to 7 and then adolescent, which really doesn't leave much wiggle room. They haven't been given those connections, so they're being given tasks that they don't go, this is foreign to me. I lost the wiring. The wiring I had has been disconnected 6 months, 12 months ago. And so it's going to take a while, if at all the connections were there prior. If they were there before, we've got to build on them. If they weren't there before because they are in that age bracket there, then we need to actually create them for them, and therefore be, you know, far more acutely aware that we need to give added activity. So rather than possibly structuring, have a more flexible plan.
And anytime there's a distance between either what society or parents expect of a child and what they're developmentally capable of doing, pretty soon that space starts to create more and more problems for that child. So do we need to back up a little bit and take the pressure off and not expect, just like an athlete warms up, we can't go straight back to pre-pandemic expecting everything. Do we have to coax them along a little bit and let them warm up?
Yes, yeah, by all means. That, you know, I just as it was a trial and error when COVID started, and there was that block of time, and we did trial and error of, oh, what's this going to look like at lockdown? You know, how are we going to make this work? How are we going to make this function in the home? How are we going to continue, you know, the schoolwork? We need to just press a pause button, and yeah, be more empathetic. I think, you know, empathy, you know, and kindness. You should always try, you know, to be kind wherever possible. And it's always possible to be kind.
Yep.
It may not be ideal, but I think we need to, it needs to be a kinder world. And I think in a way that's what COVID is the takeaway. If nothing else, be kind to each other, you know, and understand that the academic is not as important as the person.
Yeah. And it doesn't have to be that much, Katie. When I do my talks or presentations, that's what I try and get across. Good enough parenting is actually better than good enough. That perfect intensive parenting is actually a road to ruin. And we're constantly faced with the busyness of life and hectic, and we're trying to make up for lost time and income with COVID. And
correct,
family dinner has such profound, lasting impacts going forward. And I understand we don't all come together now, but if you look at some of the preponderance of research about, you know, drug use, you know, finishing school, all the rest of it, just from a family dinner. And while we mightn't be able to do it every night, if we can program it in and make it a non-negotiable, so that with the boss,
it's about showing up.
Yep.
Yeah. I think it's about, you just show up, you know, not necessarily even in dinner, but that'd be perfect in a utopia. But if people can't do that, it's about showing up. It's about sending that message to a child, even if you're texting it to the child.
Yeah.
Daily, there should be a show up by an adult at some point in time, you know, twice a day. We clean our teeth twice a day. We shower twice a day. Show up for the child twice a day. Text, hey, I like the way you had your hair this morning. Hey, I really, you know, I couldn't help but notice this. Or, you know, build on their strengths. Don't acknowledge their weaknesses at this point in time. You know, it just needs authenticity. We just need to be authentic, and authentic even so far as going, hey, look, you know I haven't had time for you, and you know, I've still got to finish this, but I just want you to know that I am acutely aware of the fact that, you know, I haven't done something with you today, or I didn't get to do it yesterday. So if you can make a note of it, if you can think about what you'd like, when I get the time, we can negotiate. You know, you're not going to Disneyland, but you know, I will try to be there for you.
That's what I say, Katie. It's the moments between the moments where the magic lays. It's not the 4-week holiday Disneyland trip. It's not. It's the 10 minutes on the bed at the end of the day, just having a chat.
Exactly.
It's the walk to school on the mornings when you can. It's the conversations in the car where you let your child lead lead the conversation, and you just become the willing participant, or, you know, the facilitator in whatever activity.
Exactly.
Just step back and let that child realize the autonomy, as you mentioned, and that self-efficacy.
Yeah,
that's where it lies. Connection and love are everything.
correct. It is. Ultimately, we come into the world believing we're loved, and we want to leave this world believing we were loved. So anything we can do to show each other at any moment in time that we're loved, the children remember that forever. You know, they don't remember, you know, the adversity. They remember the love they got and want more of that.
What a great way to finish up our segment. Katie Lee, thanks so much for your time on The Informer.
Thank you, Michael, and have a wonderful day.
You too.
Okay, bye.
Bye.